Welcome to my channel. Now today's presentation is part 1 of nursing practice questions and answers about prenatal period. Now let's start with the first question. The nurse is providing instruction to a pregnant client who is scheduled for amniocentesis. What instruction would the nurse provide? So these are the options. Option A, strict bed rest is required after the procedure. Option B, hospitalization is necessary for 24 hours after the procedure. Option C, an informed consent need to be signed before the procedure. Option D, a fever is expected after the procedure because of the trauma to the abdomen. Now for this question, the correct answer is option C. An informed consent needs to be signed before the procedure. Now let's move to the rationale. Because amniocentesis is an invasive procedure, informed consent needs to be obtained before the procedure. After the procedure, the client is instructed to rest but may resume light activity after the cramping subsides. The client is instructed to keep the puncture site clean and to report any complications such as chills, fever, bleeding, leakage of fluid at the needle insertion site, decreased fetal movement, uterine contractions, or cramping. Amniocentesis is an outpatient procedure and may be done in the obstetrician office or in a special prenatal testing unit. Hospitalization is not necessary after the procedure. Now let's move to the second question. A pregnant client in the first trimester calls the nurse at a healthcare clinic and reports noticing a thin, colorless vaginal drainage. The nurse will make which statement to the client? So these are the options. Option A, come to the clinic immediately. Option B, the vaginal discharge may be bothersome but is a normal occurrence. Option C, report to the emergency department at the maternity center immediately. Option D, use tampons if the discharge is bothersome, but be sure to change the tampons every 2 hours. So for this question, the correct answer is option B. The vaginal discharge may be bothersome, but is a normal occurrence. Now let's move to the rationale. Leukorrhea begins during the first trimester. Many clients notice a thin, colorless or yellow vaginal discharge throughout pregnancy. Some clients become distressed about this condition, but it does not require that the client reports to the healthcare clinic or emergency department immediately. If vaginal discharge is profuse, the client may use panty liners but should not wear tampons because of the risk of infection. Finally, if the client uses panty liners, the clients need to change them frequently. Now let's move to the third question. The nurse in a healthcare clinic is instructing a pregnant client how to perform kick counts. Which statement by the client indicates a need for further instruction? So these are the options. Option A, I will record the number of movements or kicks. Option B, I need to lie flat on my back to perform the procedure. Option C, if I count fewer than 10 kicks in a 2-hour period, it could be because my baby is sleeping. Option D, I need to place my hands on the largest part of my abdomen and concentrate on the fetal movements to count the kicks. Now for this question, the correct answer is option B. I need to lie flat on my back to perform the procedure. Now let's move to the rationale. The client will sit or lie quietly on the side to perform kick counts. Lying flat on the back is not necessary to perform this procedure because can cause discomfort and present a risk of supine hypotensive. The client is instructed to place the hands on the largest part of the abdomen and concentrate on the fetal movements. The client records the number of movements felt during a specified time period. In my presentation, my reference book have used SAUNDERS Comprehensive Review for the NCLEX-RN examination 9th edition.